Greetings. Welcome to my YouTube channel. My name is Mushtaq Memon, Professor Emeritus from Washington State University. From our last video on artificial insemination, we determined that we need to figure it out if these cows get pregnant to measure the success of artificial insemination. So this video is exactly on the topic from insemination to pregnancy, proof of success. And again, this is focused only on bovine. So we can start talking about the pregnancy diagnosis. The most commonly technique utilized is the palpation per rectum, or some people call it rectal palpation. It's the most commonly used technique in small dairies as well as most of the developing countries. And obviously, there are some other techniques and technology available. One of the most common one is ultrasonography, where ultrasound machine, you could do the transrectal, very early pregnancy diagnosis with the ultrasound. But the justification of that machine technology and time is that if you've got very large dairies and the resources available for doing ultrasonography. So today, we are going to focus most on rectal palpation or palpation per rectum. So everybody wants to do pregnancy diagnosis as early as possible. So the early pregnancy diagnosis in cattle is done by, reliably I should say, done by membrane slip technique. Now what does that mean? Well, as you can see on this picture, on the left-hand side is the reproductive tract of a cow from a slaughterhouse, which is during early pregnancy. So I'm trying to slip that in the middle of my thumb and finger to show you how it's done. So what you're slipping? Well, look at this right-hand side picture. It's a uterus, and then we cut it open, and there's a white thread you see there. What that one is, that is part of the placenta, the chorioallantois. So obviously when cow gets pregnant, she has a placenta. So what we try to do is to gently go in and try to isolate this horn of the uterus, which is, pregnant. Then you gently try to slip that chorioallantois between your middle finger and thumb, in a way I do it. So you can slip that chorioallantois. So obviously, if the cow is pregnant, we'll have the chorioallantois where you can feel that membrane slip. If she's not, then you would not have a membrane slip. Easy said than done. Requires some practice. So please, if you are serious about that, try to, do it under the supervision of some trained veterinarian, and then try to practice. So there is some little details involved with it. So here again, we have a reproductive tract on the right-hand side and also on the left-hand side. So on the right-hand side, what we are trying to demonstrate here is the uterus retraction technique. So if you are going to identify the uterus and then try to go in the middle of these two uterine horns, and identify that broad ligament, which is part of the intercondylar ligament of the uterus, then you stick your middle finger and try to pull the uterus gently towards you so that uterus is in access to your fingers, so you can go ahead and try to find pregnancy. But it's kind of hard to do in early diagnosis of the pregnancy. So the other technique is that you do indirectly, which means that you pull gently the uterus back and then take one horn at a time and pull gently towards you, and then try to have this membrane slip. Again, it can be overwhelming, but anybody can learn it. So it just requires a lot of practice. Let me share with you the importance of this membrane slip technique. I was assigned to Russia for about 2 weeks, and to help with different dairies. A very big country, interesting country. It was very educational for me to go in this very large country with 10 to 12 time zones. One part is in Europe, other part is in Asia. And interesting way that they operate their dairy farms. As you can see here, one of the many pictures I have, that this 2-horse buggy is delivering feed for cows in this very large dairy. So this dairy farm where I am palpating this cow was my host. And just immediately behind me in the middle is Dr. Andrei, a Russian veterinarian and farm manager, very experienced gentleman. And next to him on his right-hand side is a lady who's also veterinarian, and on his left side is a younger veterinarian, all working on this farm. So when I went there, they asked me what I like to do here with these cows. I said, go ahead and bring all your cows which are not getting pregnant or have some other reproductive problems. So this cow which I'm palpating, which is supposed to be infertile cow, and I palpated and told the staff here that she is pregnant. And Dr. Andre got a little bit concerned about that. He said, no, she cannot be pregnant because he has palpated her a few times and she's not pregnant. I said, okay. Well, I again checked the second time, and again I found the membrane slip very comfortably, and she was 45 or so, about that days pregnant. He went again back. So we went back and forth and, kind of discussion at the same time, polite disagreement and argument. So we agreed that, maybe we had to figure it out why he says they're not pregnant and I'm saying that she's pregnant. Come to find out that in the Soviet Union, before, Russia was part of the Soviet Union, they taught their veterinary students to diagnose pregnancy when a cow is 3 months pregnant. Total duration is 9 months, by the way, just like in human. So they were taught how to do that at 90 days, which is too late for us in the United States. We want to do it as early as possible. So after discovering that dilemma, I sat down and discussed with them that membrane slip, which was kind of very confusing for them to start with. And that word got around, and I visited many other dairy farms, so we had a pretty good idea what we are facing here and what needs to be done. So here I am on another farm, and this veterinarian, very pleasant gentleman, and he had a lot of years of experience, but he was unaware of this membrane slip technique. So here I'm trying to, walk him through, if you will. So he has in his hand in the rectum of this cow, and he has isolated the uterine horn, and he asked me, what exactly do I have to do? So here I am with my thumb and the finger trying to demonstrate to him that's what you have to try to do, to slip that membrane. So by the end of this assignment, as I said, it was mutually beneficial, I think, to our Russian farmers as veterinarians, and also for me, because I learned a lot from it. So all these things, communications obviously happened through our translator. And towards the tail end of my assignment, Dr. Henry was so kind that he invited me to his home. And with a beautiful family, as you can see here, I'm sitting with his wife and 2 daughters and him. And he told my translator to please translate what he said. So here, the quote is even mentioned in the Journal of American Veterinary Medical Association. He said, we are happy having American colleague, which was not possible a few years ago. So it was really delightful when he mentioned to me that no other American veterinarian has come in that part of the country. So he was delighted to have me with them. So we keep on talking about cows, and our next video is going to be the other half of the reproduction, which is a male, to share with you some of my observation and experience, the best way to evaluate a male for reproduction. So until then, I wish you well. Stay healthy. Bye-bye.